for letting us. All right, boss, take it away.
Well, hello, everybody. I'm Allison Agu and Professor of Adult and Peds ID here at Johns Hopkins. And in this role, I am the Program Director of our JHM Wiki program. And welcome to our signature series, a virtual toolkit series, where the goal is to engage and to amplify. Next slide, Marina's. All right, if you've been here before, you know a little bit about JHM Wiki, but just to give us a remind us, we're five distinguished programs that span the University of Maryland, Johns Hopkins, and Sinai University, and we focus on women, infant, children, and youth. And the goal is to vision is to create a more coordinated response to HIV care by not duplicating, but establishing mutually beneficial relationships that increase how we provide care to that population. And it's to build on the existing structures and systems that we have and to create that dedicated network of multidisciplinary systems to expand and improve care. The goal of this series, which I said is our signature series, is to engage and to amplify experts. And who are experts? They're all of you. So not just us, it's literally all of us. And so if you see something, we want you to say something. We'd love for you to also share your expertise and want to acknowledge our funders, HRSA, with the grant number below. All right. So today, and this I'm not going to call it a talk. I'm going to call it an experience. So the PrEP shot, real talk, real experience is really born out of really conversations with patients. So who, what, where, when, why, and how when we talk about PrEP. And so exciting to lean on our PrEP team to help us understand that. So today, excited to have Dr. Errol Fields with his fabulous post, who's my right hand, Associate Professor of Peds at the Johns Hopkins School of Medicine in the Department of Pediatrics, Division of Adolescent and Young Adult Medicine. Dr. Fields is an expert at all things, primarily HIV, prevention, outreach, social media outreach, literally all things sexual and reproductive health care, treatment, prevention of HIV, and really engages in research that addresses spatial and social epidemiology to understand where to reach, particularly young people and young people on the gender and LGBTQ spectrum in terms of engagement in care and prevention. He's a program director for Adolescent Medicine Fellowship Training Program and supports adolescent medicine fellows, which we need, training in health development, health disparities, and addressing vulnerable and marginalized population. He's really committed to the vision of evidence-based, culturally competent care of sexual and gender diverse youth and is involved in all levels of education, from undergraduate to continuing medical education, and really is an expert in this space. He leads our PrEP team, he leads our testing team, and really excited to have him always as my right hand as we push this forth. And then Lady Diane is an experienced registered health nurse and it has over a decade. She looks like 12, but she has over a decade of experience and expertise in adolescent and young adult healthcare. She serves as a nurse case manager and research nurse in the clinical setting focused on supporting youth with diverse gender identities. Diane, or Lady Di, is passionate about providing compassionate, patient-centered care to young people, empowering them to make informed decisions about their health, dedicated to advancing care practices through research and advocacy, ensuring that every patient receives the highest standard of support and care. With that, I'm going to turn it over to you two, and I should not stop. I should stop and say, want to acknowledge Charles Clark behind the scenes, our multimedia social media manager, who's helpful and actually pivotal to having a lot of what you did or you're going to present today. So turning it over to you guys, and we'll be silent and off the mic. Thanks. Take it over.
Great. Thank you so much, Allison. Share my screen. All right, so today we are talking about the PrEP shot, real talk, real experiences. And just to set us up, today we're going to break down the PrEP options, including the shot, in ways that really resonate with youth. We're going to demonstrate what the PrEP shot involves and what patients can expect. We'll hear from Lyra, one of our patients, and learn from her experience with injectable PrEP. And then I'd like to build on her perspective with insights from youth experts who I'll introduce a bit later, will really help to address concerns, reduce stigma, and support informed patient-centered decision-making. So you see the slide. This is often how we define PrEP in medicine. You can see it's very technical. There are medication names, dosing, eligibility criteria, approval language. And all of this information is accurate and important from a clinical standpoint. But this is not how most young people are thinking about their health or making decisions about their health. If this is how we explain PrEP to patients, it's very easy to lose them. So the challenge for us isn't just knowing this information, it's translating it. Taking something that looks like this really complicated slide and turning it into something that actually makes sense in a young person's life. And that's really what the rest of this talk and this toolkit is about. How do we take these options and explain them in ways that feel clear, relevant, and usable? And when you do that, when you strip away all the technical language, what young people usually want to know is actually pretty simple. What are my options, and what would this actually be like for me to take? So we'll start off with the pills. The pill is something you take once a day, similar to a vitamin or a birth control pill. And when taken consistently, it's extremely effective, over 99% at preventing HIV. There are two pill options, trade names Truvada and Descovy. Both work extremely well, but they don't fit everyone the same way. Truvada really works for everyone, while Descovy isn't used if someone's risk is through receptive vaginal sex. With pills, patients come in about every 3 months for follow-up and testing. And for some young people, this works really well because it gives them control. They can start and stop depending on their risk over time. But it does require remembering to take it every day. And for some youth, that's really the biggest challenge. Things like busy schedule, like privacy at home, or just not wanting a daily reminder can make pills harder for some young people. And so the pills work great for some, but not for everyone. And for a lot of young people, the biggest challenge is really is that daily routine, having to remember to take something every day and having it be a part of their life in that way. So rather than really struggling with the daily pill, which many of our youth do, or stepping away from something that's a really highly effective prevention strategy altogether, we really can offer different ways to help PrEP fit into someone's life. So introducing the shots. So these are medications that you don't take every day. Instead, you get them as injections in clinic. There are currently two options, cabotegravir or cab, trade name Apretude, and that's given every 2 months. And then there's lenacapavir or len, trade name Yes to Go, is given every 6 months. Like the pills, very effective, but they fit into someone's life in a very different way. For a lot of people, young people in particular, the biggest appeal is that there's no daily medication to remember. It can also feel more private. There's nothing at home. There's nothing to keep track of except for your appointment times, which I'll come to in a second. But really, you can set it and forget it. There are some important things to consider in some ways in which it can be challenging. These are injections, so there can be some discomfort. Some patients might notice a lump or bump at the injection site. They also do require you to come into clinic pretty regularly on a pretty strict schedule. And it's important to stay on that schedule to keep protection consistent, to keep the levels of protection consistent. And unlike a pill, once that injection is given, it stays in the body for a while. So it's less flexible if someone changes their mind about being on PrEP. So again, there's this trade-off, no daily pilled, but more structured visits and really a different kind of routine. And that idea of routine, how this fits into someone's life, is really how a lot of young people and people in general think about these options and what's really going to work best for them. So we've talked about the pill options, the injectable options, but before we get into more detail, especially about how those injections actually work, I want to take a step back for just a minute, again, to think about this idea of the different rhythms of PrEP. Because for a lot of people, the decision often isn't just about what the medication is, it's about how it really fits into your life. So one way I find helpful to think about this is in terms of different rhythms. With pills, you have this daily rhythm, this daily routine. You take something every day and check in every few months at your doctor's office. With cabotegravir or cab or Apretude, there's not a daily pill, but you come in every 2 months pretty strictly for an injection. And with lenacapavir or Yes to Go, also no daily pill, but those visits are spaced out even further. So they're every 6 months. So again, a little bit of a different routine. And that's really the big picture between these options, really three different rhythms of care. Um, and I think people that's fairly easy for people to recognize and understand. But when we talk about injections, that's where things feel a little less familiar. We've all had shots before, but what do these shots actually look like? What do they actually entail? Because a shot means different things depending on how that shot is given. So I want to, the next slide, we'll take a deeper look at what these injections actually involve and what they actually look like, the different types of injections that I've mentioned. All right, so on this diagram, you can see the different layers of the skin. So at the top layer, the surface, the air, what you can see is the surface. Underneath that is the subcutaneous layer or the fat layer. And below that layer, below the fat, there's the muscle. So lenacapavir or Len or Yestigo is what's called a subcutaneous injection. That means that the medication is placed just under the skin in that yellow sort of fat layer. You can see that it's typically given in the abdomen area, right under the skin. And then cabotegravir is an intramuscular injection, so it goes deeper into the muscle. This one is usually given in the glute area, which you can see from this picture here, as a deeper injection into that muscle. And that difference under the skin versus into the muscle is what can change how that injection feels and what the experience is really like for patients and for young people. For example, some people, as I mentioned before, getting that subcutaneous injection under the skin here, they may notice a small lump or bump under the skin where the medication sits. While the intramuscular injection is really a deeper, more traditional shot, so it may or may not be more painful than a subcutaneous injection. So they're both injections, but they can feel quite different, and patients often have preferences when you explain what these differences are. They can decide which one is going to work best for them. But even with that explanation, this pretty picture here, it can still be hard to picture. What people often want to know is what do these shots actually look like in real life? Like when you're getting them in the clinic, like what does that actually look like? So rather than just describing that anymore, we're going to show you a brief demonstration. Our lovely nurse, Lady Diane, has put together a demonstration to sort of illustrate what this looks like. These are demonstrations using models of the body, not real patients, but they are designed to show you what the injections will look like in practice. You'll see examples of both types of injections, the intramuscular injection given in the glute, and the subcutaneous injection given in the abdomen. And as you watch these demonstrations, think about how you might explain this to a patient, or if you are a patient yourself, what details would matter most when you're considering which one will work best for you. So this first one is the intramuscular injection.
Hi everybody, welcome to today's injection demonstration video on how to do an intramuscular PrEP injection. We are joined today by our patient Ms. who has kindly consented to be part of this video. So first things first is we are going to make sure that we have all of the correct supplies before starting. So we'll have clean gloves, we'll have an alcohol swab, a Band-Aid, and a gauze pad. And then of course we'll have our medication. Before we do anything with our patient, we always want to make sure that we have nice clean hands. So we're going to go ahead and do hand hygiene. And we're going to put on our nice, fabulous clean gloves. In order to do the injection, you want to make sure that you are in the correct muscle. So for the intramuscular injections, it's administered in the ventrogluteal muscle, which is to the side of your glute. So in order to find the correct spot, we'll have our patient turn towards us so that we can find the correct anatomical landmarks. So while Ms. is turned on this side, what we'll do is go ahead and uncover. And is it okay if I touch? Cool beans. We'll pull this down just a little bit to expose part of the gluteus muscle. So while we have Ms. positioned like so, what we're gonna do is we're gonna take our non-dominant hand at the top of the femoral bone like so, and then your right hand is going to go at the tip of the hip bone like so. Your thumb is going to be pointed and facing towards you, and you're going to separate your forefinger and your middle finger like so, And this spot is going to be your ventrogluteal muscle. I'm pressing down with my thumb to make sure that the spot is firm, to make sure that we are in the correct muscle. That looks good. Once we've found our spot, what we'll do is take our syringe with the cap on and go ahead and mark our injection site like so. And once the site is marked, I'm going to go ahead and release. What you're going to do is go ahead and take your alcohol swab and clean the site. So nice circular motions. And let that dry. While that's drying, we're going to go ahead and prepare our Band-Aid and our gauze, and we're going to let our patient know to take a big deep breath to get themselves ready for the injection. Perfect. Are you ready? Fabulous. You'll feel me touching a little bit. And what you'll do actually is take your non-dominant hand, uncap your needle, and what you'll do is pull down on the muscle like so in what we call a Z-track method. So this allows you to pull down the top layers of the skin and subcutaneous tissue to really expose that muscle. So pull down, find the spot that we just marked, and then go all the way in. Once you're in, what you'll do is just push the plunger down slowly to administer the injection. And you're gonna pull straight out. Release the muscle like so. Put your safety onto your syringe. Apply your gauze and apply a little bit of pressure just in case there's some bleeding. Are you doing okay? Perfect, you did fabulous. While applying pressure, I'm gonna go ahead and take my Band-Aid and apply it onto the injection site. Thank you so much. Go ahead and pull this up for you. Perfect. And that's how you do an intramuscular injection.
All right, so next we're going to see another patient who is opted for the subcutaneous lenacapavir injection.
Hi everybody, today we are going to be doing a video demonstration on the subcutaneous long-acting injectable. Today we are joined by Timmy Tum Tum, who has kindly consented to join us in this video demonstration. So first things first, before we go ahead and start the procedure with our patient, what we're going to do is make sure that we have nice clean hands. So we'll perform hand hygiene and put on our fabulous clean gloves. We are also going to make sure that we have all of our supplies ready for the injection, which is going to be our clean gauze, alcohol swab, and Band-Aid for afterwards. We are also going to make sure that we have our 2 medications because the subcutaneous option is 2 injections that's given every 6 months. There's actually 2 parts to the subcutaneous option, which is the oral part. So that means that you'll take 2 pills on the day that you get your 2 injections, and then the next day you take 2 more pills, and that completes the entire dose. So for today, we are going to show you how to do the injection. Timmy, is it okay if I go ahead and pull the blanket down? Perfect. We'll pull our blanket down to expose our injection site, which is going to be in the abdomen. So subcutaneous means that the injection is given right underneath the skin, which means that our needle is going to be a little bit shorter than the intramuscular injection. So for the sites, we are going to identify first our belly button, which is right here, and we're going to go about 1 inch or so away, which is right about here. You want to make sure that your injection sites are given about 4 inches apart. So if our first site is here, we'll go right about here for the second one. So once we've identified our first site, what we'll do is go ahead and take an alcohol swab. Go ahead and clean that injection site and let it dry. Again, it's very important that you let the site dry after you clean it with the alcohol swab, because if you poke yourself with a sharp needle while the alcohol is still wet, it's not going to feel good. And while that's drying, we're going to go ahead and prepare our gauze and Band-Aids. Looks like our site is dry, so we're going to go ahead and administer the injection. You feel like you're ready? Perfect. We'll take our cap off, like so. And what we're going to do is we're going to pinch 1 inch of the subcutaneous tissue like so, and we're going to administer the injection at a 90-degree angle, so straight down. So pinch your inch all the way in, administer the injection. Perfect. And then pull straight out. Your safety on. And then apply your gauze if there's any bleeding. And then apply the Band-Aid onto the injection site. For the second injection site, we are going to do the same. Do you feel okay? Cool. Do you need a heat pack or a cold pack? Okay, maybe later. So we're going to find our injection site, again, 4 inches away from the first one. So we'll go ahead and clean that. Phenomenal. And while that is drying, we are going to go ahead and prepare our Band-Aid. And gauze. Apologize for all the trash I've piled yonder. All right, do you feel like you're ready? Perfect. Again, we're going to go ahead and pinch an inch all the way in and administer your injection. All the way out. Safety on your needle, gauze, and then a Band-Aid. Perfect.
All right.
Hi, everyone.
So we've talked about the options and seen what those injections look like in practice. I think that still doesn't fully capture what it's actually like from a patient perspective. And so I want to shift us now from what we do as providers to what it feels like to go through this as a young person. So we're going to hear from Lyra. She had actually planned to join us live today, but had to work, but still was really excited to pre-record her thoughts and experiences with PrEP. So in this next video, she shares how she thought about her options, what influenced her decision, and what the experience has been like for her. Again, as you watch this video, think about what stood out, what mattered to her, what might have made things easier or harder, and how we can better support young people in making these decisions and starting and staying engaged on PrEP.
Okay, ready? Lights, camera, action! Hey guys, what's up? My name is Lyra, also known as Miss Lyra, and also known as the greatest of all time. And I'm here with Harriet Lane to talk about PrEP.
What made you consider starting PrEP, and what questions did you have at the time?
Well, actually, what made me consider starting PrEP at all was because I was talking to a guy at the time that actually did have HIV. And even though he was taking his medicine and it wasn't really detectable in him and everything, I just wanted that extra layer of protection because I would rather be safe than sorry.
What was it like getting your first injection, and how did that compare to what you expected?
For getting my first injection, I thought it was going to hurt really bad, actually. Like, I thought it was a big old needle stabbed right into the side of me, but it was actually painless. Well, personally, I didn't feel anything at all. It was quick and easy, and it was something that I don't have to worry about constantly, so it was just one and done, just like that.
What do you like and not like about injectable PrEP in comparison to the pills?
Well, I like injectable PrEP. Well, the reason why I got it was because it was something that I had to worry every 2 months instead of every day. Me being forgetful and, forgetting to bring my phone to work sometimes, literally all I have to do is just come in every 2 months, get a shot in the side, and I'm out, instead of taking something every day like a pill.
What challenges did you face getting or staying on PrEP?
Well, the only challenges that I really faced were transportation. Being able to come here every 2 months or however, that was my only worry that I really had. But the clinic, they got my back.
What helped make the process easier?
Definitely the navigators, being able to communicate and make sure that my appointments were ready, that I had everything that I needed for an appointment, and actually sending me my lift for the appointment as well. Very communication oriented, and that's what I love. Like, they always got your back. Shout out.
What makes a provider conversation about PrEP feel helpful or comfortable?
Definitely the reassurance of everything. Making sure that I'll be okay on this injection, that everything going forward will be okay. I mean, personally, just the mental reassurance that that something that I'm taking will make sure that I'm okay always. That's the best thing that all I could ask for, really.
And what should providers do differently when talking to young people about PrEP?
Definitely this program, literally being able to show that people similar to age, younger or older, around that they're all in this together. Because even if nobody's on your side, just know that me and Miss Lyra, I always will be. Because you're not alone. Or whatever Michael Jackson said.
Have you felt judged or hesitant to talk about PrEP, and what influenced that?
Well, the only hesitation that I had when going on this was definitely telling my parents, informing them about it. I was really scared because, I mean, it's a really hard pill to swallow. I mean, you're starting this medication to prevent something that your child is exposed to, all this stuff. So being able to having that conversation is what scared me for sure. But the assurance here definitely made sure that I had no worry and just being able to be protected no matter what. I mean, I feel like that more in itself is enough to push me through, no matter who looks down or any ill words.
And how do friends or partners or family shape your decisions about PrEP?
Well, my friends actually, they wanted me to do this before I even knew about it. So just having that support group, I feel like everybody deserves that. Friends, family, or foe. But I feel like if a foe's recommending this to you, I don't think they're really a foe at that point. But always having people by your side in any decision, really, but especially this one, something that could be lonely, I would definitely recommend for sure. And I mean, it helped me get through it for sure.
What would you tell another young person thinking about PrEP?
Take it ASAP. I mean, I would want anybody and everybody watching this to be protected rather than to be worrying about a potential. I mean, it will always be a benefit for you in the end. And even if there is complications along the way, the clinic will always make sure that, you're safe.
And what would you want providers to understand about your experience?
Oh, this one's hard. Wait. I mean, I would want them to know that personally that, I mean, on my end, everything's perfectly fine. That I feel really comfortable and that their assurance and the team building around everything, that it really helped me get through all of this. Actually, to have, my friends here and my clinic people all helping me out on this journey, I would say. And that cut like that and scene. Cut.
Like, what do you think about that?
That makes sense.
Like,
That actually
if
makes
it's
a
a
lot of
provider
sense.
that's not comfortable or feels like unsure about prescribing PrEP, like, what would you want them to know about this experience?
That's amazing.
And
10 out of 10.
all right.
Prescribe to everybody and anybody. Everybody should be taking it.
You get PrEP and you get PrEP.
Yes.
All right.
All right.
Okay, ready?
Thank you to Lyra for sharing that. I think that was really a lot in her story that reflects what many young people experience and when they're thinking about PrEP. And we heard from her just one person's perspective, but many of the themes that she raised, questions about options, concerns about telling people, conversations that she had with providers, help support from navigators, are the things that we hear over and over again. So to build on that, I'm really excited to bring in our panelists, who are all subject matter research consultants with the Adolescent Trials Network. The ATN is a national research network focused on improving HIV prevention and care for adolescents and young adults. And a big part of that work involves partnering directly with youth to make sure that research and care actually reflect real world experiences. And our panelists bring those perspectives, combining lived experience, community insight, research expertise to how young people are thinking about PrEP today. So on this panel today, we'll have Raheem Miller, Zoe Injamanze, and Joseph Ingram. You can see their pictures here, but I'll stop sharing the screen in a bit so we can all be on the screen together. But just by way of introduction, Raheem brings a strong clinical perspective with experience as an EMT, a medical assistant, and a research coordinator, along with community-based training and education through his program, Raheem's Rescue Academy. Zoe brings a research and systems perspective, focusing on youth, sexual health, and HIV prevention, and working to translate research into real-world practice and communication. And Joseph brings a really important peer and cultural perspective as a college student, a peer health educator, and leader in creating affirming spaces for LGBTQ youth. So together, this panel, I think, really represents clinical research, lived and peer experiences. And what we're going to do now is build on Lyra's story, build on her perspective with a conversation with these young people, thinking about what stood out, what reflects broader youth experiences, and what this means for how we approach PrEP with young people. So let me stop sharing my screen for a moment so we can see each other. All right, welcome everyone. Thank you all so much for being with us today.
Hi, Errol. Thank you so much. I just want to make sure in our conference room you guys can all hear us.
Yes,
Yep.
hello.
I can hear you.
Yeah, we can hear you. Thank you, guys. Let me pull up my questions. So first questions for the group. Just thinking about what you just heard from Lyra, what stood out to you? What feels most representative of what you're seeing with youth more broadly from hearing her story?
One, Lyra's present, like that energy, everything. Like, I really wish Lyra could be here, like live today, because I just want to tell her like that was everything. And I think one of the things that really stood out to me when I was hearing her story was, she mentioned that her friends had wanted her to get on PrEP before she even knew what PrEP was. And I think that kind of does speak to the disparity of like awareness and knowledge within the community, especially for younger people. Like, it is very select people that have had the access to knowledge about PrEP and those that have not. So I really appreciate just this format of where we're now able to kind of disseminate this even more so to youth. But that was one thing I've definitely seen a lot within my career and like within my environment.
Yeah, we still have a big problem with awareness. So it absolutely was a good pickup on her story, her experience.
I think that's one thing I did see with like Lila's experience is that you could tell that it had made her feel better about being herself, and that it had made her become this person, like an advocate for the change that she got with the injectable. I think it was, to me, kind of like it introduced me to the possibilities of what you can actually get. I wasn't aware of it until today. I was going to say this in the previous another question, but I wasn't familiar with the injectable until like right now. Is when I got to realize that is the ad I be seeing when I'm trying to watch Drag Race. Every time I watch Drag Race, the ad comes on. It'd be like Aptitude, 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 and I wasn't familiar with it until actually hearing her experience. And I'm like, oh, they're trying to get us, and they're definitely marketing us to the right way. But actually knowing what it is and how the process goes, it makes me a little bit more excited to tell even my own friends about it and even experience it myself.
Yeah, absolutely. I mean, I think that's one of the reasons why we thought it was important to have a real patient talk about her real experiences, because the ads are, like I said, the ads are everywhere, but like she actually kind of like sat down and told us what her experience was, and kind of seeing Diane actually give the injection, I think is really informative to folks.
Yeah, if I can just jump in. I first off, yes, love Lyra's energy. I think what really resonated for me is this idea that access is intersectional and multi-pronged. So it's more than just awareness that moves someone to behavior change. So things like home stability, job stability, and transportation. So I mention a lot, I am in Houston, which is a very sprawled out metropolitan area. You can drive somewhere an hour, 30 minutes, and you're still in the city. So thinking about transportation, we're not a walkable city, and we don't have public transportation that is really reliable or good. So the transportation aspect really resonates with me, especially where I'm from.
Yeah, absolutely. And that's been a big benefit that we've been able to provide transportation to our patients because, like you said, I mean, we're not as sprawled out in Baltimore as you guys are in Houston or even Tampa, St. Pete. But there's still challenges with getting places. If you don't have a car, if you don't have access to like money to get on the bus. So that has been really beneficial and obviously really helpful to Lyra. Um, um, Another question I have for the group, more generally, what tends to shape, in addition to what we've talked about, whether a young person considers PrEP in the first place? Like we hear that awareness is a big issue, but what really, and we heard from Lyra, like for her, it was like she was dating someone who was living with HIV, and so that was really part of her decision. But in general, like what do you think are some of the things that shape whether a young person considers PrEP as an option for them?
Yeah, I just saw in the chat where someone had asked about if minors are allowed to consent for PrEP, and I think that that is a huge consideration. Like where I live in Florida, where these laws are very fluid and have been changing over the last 4 years, quite a bit of can minors even get access to PrEP without their parents' consent? And I think that that is one of the main things or like the first things that people talk to me about whenever they're talking about whenever I'm trying to like inform somebody about PrEP, they're like, oh, do I have to go through my mom? Like, oh, well, they know because I'm on my parents' insurance. Like, I would like to do this just on my own. Like, is there a way I could do it on my own? So that is really like a initial consideration for people because logistically it can be a big stopgap to people getting care.
Yeah. I'm going to put a plug in for Maryland because Maryland is one of the four jurisdictions in the country that does have ability for youth to consent. There's a law that states they can consent for PrEP specifically. I think the places that the other, what is it? Uh, 57 jurisdic or 47 jurisdictions that don't have that on the books. They don't necessarily have laws saying they can't consent for PrEP, but they don't directly say that they can. So that's always a challenge when that question comes up.
I think kind of what has shaped my own perspective of like PrEP is being like aware of it. Kind of similar to like Lila's experience. It was being able to be in spaces with people who are living with HIV. And that is when I became aware of it. And I think that is kind of what has shaped not only my perspective, but my friend's perspective as well, is us trying to have conversations just between ourselves of if we can educate ourselves and actually help ourselves out. Like, is this safe? Is this right? Or yeah, I lost my thought right there, but that's it.
No, I think that's right though. We've seen from research that one of the biggest kind of influences of whether young people will be on PrEP is if they know somebody else that's on PrEP. They have friends that are on PrEP. So I think that was another really important part of her experience.
Not even just like on PrEP, but like in high risk situations that are like kind of make you realize like, okay, yeah, I need to be protecting myself, or I
Yeah.
need to sort of know what is out there, how to protect myself. I think I didn't know that the Office of Durham Youth had actually access to like free testing and like free PrEP subscriptions until I went out to go looking for it, and
Mm.
that didn't really register to me until like one of my friends ended up telling me about their own experiences with like being kind of not knowing who, not basically one of my friends ended up getting HIV and living with HIV. And them telling me about their experience was kind of shocking to me because we were just having conversations about them getting PrEP in the first place and getting on PrEP and us trying to go together. And I think that has kind of what shaped their perspective as well about, especially now, how to move forward and how to keep themselves safe when sometimes you just don't know.
Yeah. Yeah. That's a really good point.
Really want to focus on like the privilege that I have as being an SMRC and how my role in the ATN has increased my awareness and has benefited my education when it comes to prevention. And we were actually talking about this in an SMRC meeting that we've learned so much, and part of that is this idea, this understanding that PrEP is for everyone, and that there's no criteria that qualifies or disqualifies someone for PrEP. And I think that what that speaks to largely is how can we include youth as equal collaborators in the research process, because experiences like this, workshops and trainings, are beneficial to youth as well. Being a part of that conversation opens your eyes. I mean, just what Joseph was also saying, like, hey, I just figured this out being on this call, those kind of aha moments. I have the privilege, and I'm sure if I could speak for the rest of the SMRCs, by way of proximity, we're learning so much. Just as we are advocates, we also learn so much. And so seeing more youth faces and youth in places like this is I think something that's going to help youth consider being on PrEP more.
Yeah, that's a great point. One of the things I love personally about research that's collaborative with youth is that I constantly hear that message. Not only am I getting information from youth about how we can move HIV prevention forward, I'm also hearing from youth how much they're learning and how much they're experiencing, how beneficial it is for them to be a part of that process. So I 100% agree with that. Um, let's think about how youth are thinking about injectable PrEP right now, especially compared to daily pills. It is out there. People are starting to hear about it. Um, we've definitely had a challenge with rolling out PrEP in the oral form to youth and to lots of different populations, frankly. But how are you thinking about the injectable PrEP option from what you guys have experienced and gathered?
Joseph? I think it's like a really good option, honestly. I think the biggest barrier with youth staying on PrEP is being committed to something and being committed to like bettering yourself in a way. I think something I was going to say was that sometimes I think youth, especially even my own friends, think that because they're all right today and maybe tomorrow, and they're still doing the same things that they were doing like 2 months ago, that they don't need to be on them. And that maybe it's just gonna like however it might feel might go away, or they just feel like they don't want to admit to themselves that this is a problem or it's gonna be a helpful thing. I think staying or being aware of PrEP is, how can I say this? I think it's being aware of not only yourself but of the options that are out there and the ways that people can help as long as you ask for that help though. And I think that's another problem with youth is that they don't know how to ask for help. They'll just keep going until like they'll figure it out. And I think that one of my biggest barriers is to kind of I'm trying to break into the stubbornness that I know most of us have in not wanting to um, admit that there might be an issue or there might be something out there that could keep us safe. So, um,
Yeah,
I also, I guess it says what helps. I think what helps is being honest and having conversations about it, but also knowing that there are free resources out there for you. There are ways for you to get there and get to places where you don't have to jump through so many hoops or go through so many people. There's just one person or a group of people or a clinic, just people that care about you. Because sometimes it might take a village. It might take someone to just believe in you, for you to believe not only in yourself, but to also want to help other people.
yeah, no, that's a really good point. I also want to pick up on what you said about um, I think we oftentimes wait for youth to ask for things, but for when it comes to PrEP, like we need to be mentioned, we need to be bringing it up as providers. We can't wait for youth to come to us with it because most time that's not typically going to happen. So I think that's a great point too.
Yeah, to chime off on that too is just the message of like self advocacy of like youth not understand like knowing how to ask for help or knowing what to ask. I think like in terms of injectable PrEP, like there's a lot of questions around the injectable format, right? Like hearing that, you may have to take pills and then do the injection, then take pills again.
Okay.
There's two different injection sites, there's different like rhythms to the injection pattern, and I really like the rhythms to PrEP. I'm going to start using that. But I think like how youth are thinking about it is that there is a lot of confusion, and it's while it can still be like hopeful for people that like me like suffer from pill fatigue and Like I know I'm supposed to take my med every single day, same time, and it gets that time, and I see my alarm, and I'm just like, I'll take it a little bit. I snooze the alarm, and then next thing I know, it's 3 hours later. I didn't take it. And like, or people that really don't like taking pills. Like I was speaking with Joseph earlier, and Joseph told me, like swallowing pills is like a chore, right?
Yeah, it's a lot for me.
So like it can be very hopeful for someone that it encounters these kind of like barriers to the pill fatigue and then swallowing pills. But there's a lot of questions that still need to be resolved before some youth feel like safe or comfortable having an injection, and putting something in their body. And I think that, like you said, like it's providers' responsibilities to, impart like this information. But I think there is like this village aspect of teaching youth self-advocacy techniques and teaching them the questions to ask when they're in the clinic and teaching them, like when you ask this question, these are, like responses that this is how somebody should respond to you, because a lot of people don't know. They'll ask a question and then they get a response and they think that that's generalized to the whole healthcare field. But there's definitely a difference in the care that you receive from one clinic to another.
Right. Yeah, absolutely. Um, I want to give Zoe a chance to comment on this question as well, but I also, one of the things that struck me about Lyra's testimonial was that she clearly just, and I think it's kudos to us, but she clearly trusts us in our clinic a lot, and she kind of relies on us to make sure that she's safe. But sometimes that's not that. A lot of youth don't have that perspective, and so I'm curious about your thoughts about how we can do better at building that trust and building that confidence in the youth that we take care of so that they can rely on us to get the answers to those questions and to be confident that we're giving them the right information when it comes to some of the confusing aspects of injectable PrEP.
Speaking to that, I think one of the things that can complicate that relationship is changing insurance plans and thereby changing providers. And so having to totally rebuild that rapport and that trust from ground zero. And I do agree with what you said earlier, which is I often find myself advocating for what I want more than my providers asking, like, hey, are you interested in this? I come with my bullet points and I'm asking like, hey, I heard about this. We need to, tell me more about this. What would you recommend? And but also understanding that that takes a lot of power and energy from me to also stay educated. So I think having that dynamic that's not too paternalistic, but also feels like an equal collaboration between your provider and yourself, looking for what works best. And I also just want to ditto and confirm what Joseph and Raheem were saying. And pill fatigue is a really big issue for me personally, because I am on medications for a few different things. And so, even in terms of contraception devices, I'm like, I need something that's going to make sure that I don't have another timed medication to be thinking about. And then also just being a young person, like Friday, Saturday nights, I want to go out, I want to party, I want to, I want to have a good time. And so I'm not waking up Monday, 8 a.m. every day. That's in all truth. And I'm not going to bed 10 p.m., every day. Every day is totally different. And I'm out living life and engaging, in life. And so I think there's also that realistic aspect of understanding which method works for people who live real lives.
Yeah, absolutely. I'm a little bit jealous because I do go to bed at 9:30 and we those days are beyond me, but I hear you. I definitely hear you. I saw in the chat that Lyra is here. I don't know if she wants to join the panel or join the discussion. You definitely, I don't know if you're here for your video, but everyone loved it. You were amazing. Um, I will uh, go on to the next question as we're teeing that up potentially. Um, I think, and yeah, this is kind of along those lines, thinking about Lyra's story, what makes those conversations with providers work well, and when do providers actually miss the mark? Like, how do we, again, how do we um, build on the successes that we've had with patients like Lyra, and what do we need to do to improve our engagement with youth?
So I'm going to pass on responding, but what I will do is I spoke with other SMRCs, and even though they can't be here with us, I do have some
Yeah,
quotes from them. So I'm going to
perfect.
share
Thank
some
you.
quotes from them in the chat and give
Yeah,
space for people to kind of read those.
great. Thanks, Zoe.
Yeah, I mean, you guys are clearly at your clinic. You guys are doing great with communicating with patients, like based off of Lyra's experience and what she shared in her video. Like, I mean, that trust that you mentioned, that Lyra has with you all is really something that I wish like everybody can experience.
Yeah.
And I think that like looking back to Diane's videos, right, the demonstrations and the frequency of checking in with this patient, making sure everything is okay, explaining what's going on, explaining why she's doing these things. Like there's a lot of like trust building and explaining and teaching to your patient and then letting them have the tools and the knowledge so that they can make an informed decision and know what's happening. And I think that some providers are, I think it based off of administrative burden, they're pressed for time. Like there is less time and less availability to have this interpersonal connection and these teaching moments with every patient. And I think that that does lead to kind of this brevity or maybe even like this perceived coldness that does, miss the mark with a lot of youth because we are also living busy lives with multiple influences, but when we're seeking help or seeking treatment, being brushed off in that environment can also uh, make us feel adverse to wanting to come back.
Yeah. Yeah, that actually reminds me, I want to give another shout out to Charles Clark, not only as our social media manager, camera person behind the scenes, but he's also a navigator. And as a navigator, he's able to spend more time with patients when we're busy between patients, able to reach out to patients between visits, able to support patients, as Lara mentioned, to kind of get them ride to clinic, make sure they're able to access their medications, to get the prescription, they have all the things they need in order to set up the appointment. Like there's a lot of things that the navigators like Charles do that really make this process much more doable and workable for our adolescent and young adult patients. So definitely kudos to him and to our other navigators.
Like, Lila's story does remind me of my own story in a sense of where I I was in like a very like abusive toxic relationship, and it was very hard for me to get out of that relationship. So much so when I had went back, I had unprotected sex with him, and I started to feel kind of I'll say I started to feel like I was going through or developing kind of like I think it was a STI. I feel like I was developing an STI and I wasn't necessarily aware of what that was. So much so I was looking up things on like Google and I was just running through so many different forms and I was like, what is going on with me? I had felt like I had developed herpes because of what I had done with him. And it had took me to wanting to go to I went to the first aid, I went to the ER and they had diagnosed me with what I thought I had, which was herpes. But I still didn't feel like I didn't get any answers. I felt like I didn't know what to do basically. I didn't know how to have conversations with my friends about this or my family. I didn't know how to even confront my own self with what maybe had just happened. So it had made me kind of continue to keep going back to the clinic. So I started to look up a lot of different resources for myself, and I had went to the Durham Public Health Office. I went there twice. The first time I went, I had done some research on my own, and I found that what I was going through wasn't necessarily what I thought it was. It was an stress. It was so much anxiety I had. And when I went into that room, it was kind of like I didn't know what to even ask her. And I was like, do you think I have it? What is going on? What can I do? When I first talked to her, she was just a nurse and she had told me, well, yeah, if you already been confirmed at the ER that you have it, then why are you here? And I'm like, well, I don't know. Like, I'm just trying to get second confirmed shit. I'm just trying to get my mind clear. I'm trying to just get myself to a place where I think I know what I can do now with my life. And she didn't make me feel the most better. Like the clinic made me feel like I just had to figure it out on my own. they're like, we give you some pills, but you have to come back in the next month or something.
Mm.
So I just felt kind of pushed aside and ignored. Once I had got an answer from someone else, it was basically that was it. And I came back again. This time I was like, okay, someone's gonna have to help me. Like I just want to figure out what's going on. Can you prescribe me? Like, can I get on PrEP? Could you prescribe me just something for this? Because I'm still feeling stressed. I'm still feeling itchy. I'm just scared. So when I got into the office, so I told her about my experience. I told her my story, and she had told me that she would have never diagnosed me with herpes if she would have known everything I was going through. And the way that she was talking to me, she had literally came up to, of course we're virtual, but she had literally, I don't know if you guys watched Drew Barrymore, but she was very in my face with it and just very honest with me. And she had held my hand and told me that like, no, you don't have herpes, but I believe you're going through a lot of stress. You were under a lot of stress. And I'm so sorry that you had to go through that. And she was like, do you have a doctor? I was like, no. She was like, okay, I
Mm.
cannot be your doctor, but please come back. And she prescribed me PrEP. She prescribed me also, she gave me condoms. And she just made my anxiety kind of go away for a minute. And she had even asked me before I left if everything was okay. And I was like,
Mm.
actually, yeah, I think everything's okay. I'm fine. And she had even called me, I think like a couple weeks ago, because I had missed my appointment. And she was just like trying to make sure that everything was all right still. And I think that is what is kind of the provider's job in a way is to be able
Mhm.
to provide with meet me where I am right now with my emotions. Because I think that's
Yeah.
what's also is the concern is like I'm scared. I'm scared because I'm not only holding that stigma, but I'm holding in the social context. I'm holding in my own history. I'm scared, and I
Yeah.
don't know how to not be scared because I'm not. I've never done this before, and I've never really actually opened up and told that story yet until now. But I think that's
Mm.
the kind of the strength in it is that I was able to figure it out, and I'm on PrEP, and I was definitely I feel better about it now. I feel like I was able to get out of the situation, and I'll clear my head, and now I want to be able to tell working, especially in these spaces, I would be able to tell doctors and providers how it was for me and what I might have
Yeah.
needed in that moment, which was just someone
Yeah.
to be honest with me and real with me, and not necessarily
Yeah.
hold my hand, although that was nice. It's just like being able to tell me that everything's going to be okay. And she was like, even if you do have it, everything's going to be all right.
Yeah. Well, thank you, Joseph, so much for sharing that story. I think that's incredibly powerful, and informative for this group because it sounds like you were at one point kind of dismissed and like your feelings were not taken into account, but then we were able to connect with someone who was able to do that. That made a huge difference, and I think that's a really important lesson for us as providers. Um, that you have to sort of be in the moment with the patient and really acknowledge and understand and empathize with what they're experiencing. Otherwise, you're not going to be able to connect with them or really provide them with what they need. So that's a really important message. I appreciate that. Um, I want to we only have 2 minutes left, which we should have anticipated from this fabulous panel and the videos and whatnot that we had. I know there's been a lot of questions in the chat that I haven't been able to keep up with, but in the last few minutes, if there's anyone that has a pressing question they'd like for the panel to respond to, please come off mic and answer that question or ask that question. Otherwise, we'll have our fabulous leader take us home and wrap us up.
I don't have a question. I just have a pressing comment to
Yeah.
say thank you very much for this moment. I want to thank the panelists and everyone involved for bringing this to our attention. And it's going to really help me carry it forward. And I want to encourage you all to keep up the great work. Thank you.
Yeah. I echo those thanks to the panel, to Lyra, to Diane, and Charles. This was a really great session. Thanks to all of you.
I had a really, I guess it's more medical question. In the beginning, it was noted that for injections, you couldn't just suddenly stop. I just wanted to understand what the side effects were potentially if someone, like, let's say had a couple injections, but then they just abruptly stopped, what those side effects could be.
Yeah, so that's a great question. It's not so much that there are side effects, but the challenge is once you're if you're you are on an injectable method, that medicine lingers in your system for a long period of time. So there's a time period for lenacapavir is going to be 6 months. For Apretude and cabotegravir is going to be 2 months, where you still have some of that medicine in your system, but it's not at high enough levels to protect you against HIV. So you're at risk for acquiring HIV in that kind of, we call it the tail period. You're at risk for acquiring HIV, but also at risk for acquiring an HIV that's going to be resistant to that medication that we also use for treatment. So that's why it's so important for folks to stay on time with their doses so they can maintain that protection. And if they do decide to stop, that we have other strategies for protecting themselves from HIV, either condoms and whatnot, or going on an oral medication that can sustain that protection when you're in that tail period.
Thank you so much. That's so helpful. Thank you guys for everything. This was amazing.
Yeah.
Awesome. Thank you all, especially the Queen. I know she's trying to get home. I was hoping to give her the last word to stall, but this was everything that we were hoping that it would be. Diane with the amazing consenting injections, Charles in the videos, and then, Lyra, I think your testimony was just so critical for young people to truly, from a young person going through it, what the concerns could be and what goes into decision making. So thank you all. Want to definitely highlight that on the 16th of July, we're going to have the sister session on treatment, the injections for treatment. And so some of the same things in terms of the injection, but definitely the decisions and what goes into it may be different. I left out the host. Errol, fantastic job, narrating and curating, and all of you for sharing your stories, especially Joseph for being so vulnerable about your experiences and what's needed for young people. So,
Absolutely.
yeah. So with that, we'll stop. This will be shareable. I understand that there were lots of questions in the chat. Our goal is for this is to pay it forward, to share it forward, so that young people everywhere can benefit from what was said today. Thank you for joining us for our virtual toolkit and hope to see you in the future. And remember, if you see something, say something. We want to hear from you as well as we aim to engage and amplify all of our shared expertise. Thank you all. We'll see you next time. Stay cool.